Carole Osborne, and I'm the author of Pre and Perinatal Massage Therapy. And as someone who works a lot with pregnant women, I wind up with them on their sides quite a bit. And pregnant women are notorious for having problems with numbness and achiness in their hip, in the sides of their buttocks, and down the back of their leg. Now that's usually attributable to a number of factors, but we're going to zero in on piriformis syndrome because that is a problem that not only pregnant women have, but other clients that you work with. The sideline position is a great position for getting at many of the structures involved in this type of numbness and piriformis syndrome, where the piriformis muscle is compressing on the sciatic nerve. It's a great location because of our alignment here. We can use movements that will help to begin to open up some space and create some stretch to the muscle. At this moment, I'm using some gentle compression to push the femur out of the acetabulum, which is putting a little bit of stretch on all of the lateral rotators as well as any of the muscles attaching to the iliotibial tract and into the head of the femur here. So I like to start out with getting some more space and some more traction on the muscle. And this gives me an opportunity to switch from rhythmic movement here. Notice how easy it is for me to use my elbow to come to the attachment of the piriformis here and zero in a little more directly with some deep tissue work. And if I wanted to switch from deep tissue work to cross fiber friction, that's pretty easy for me to get to as well from here. I've been focusing on the insertion, but oftentimes that origin at the lateral edge of the sacrum here needs our attention as well. And once again, sideline position gives me a great opportunity to get to that lateral edge of the sacrum there to hold some melting and softening fascial technique. To use some friction. And of course, everything I'm demonstrating here we would continue with for a much more extensive period of time than this little video allows us to be able to invest. How are you doing with this, Molly?
Great.
Great? Okay. It's not too painful, huh? It should hurt good. Mm-hmm. All right, good. And of course, we can also use this position where we have great access to the lateral side of the thigh here for some additional work through and around, perhaps some moving cross-fiber friction that takes us through not only directly around the greater trochanter, but also getting a little more into the belly of the muscle. And Molly, let me know if this has any place in it that creates a little stir of pain that's more intense than the other. Okay, it should still feel good all the way through this. I'm getting a little more depth using my knuckles. We're still okay, pleasurable? Mm-hmm. All right. And then I usually like to further release this muscle by working with some neurological kinds of techniques that involve movement. I might use some rhythmic movement or some slow and gentle mobilizations that bring bring the piriformis muscle into some shortening and some stretching. So just moving that joint. Or doing some positional release. So I hope this has given you some ideas and some ways that you can work with your clients when they're having piriformis syndrome. Again, remember, this isn't just for pregnant women. This is for gymnasts and dancers and cowboys, right? People who have their legs in external rotation for long periods or have a tendency to walk in that direction oftentimes are dealing with the same kind of discomfort. Thank you.